The dark side of positive thinking. Toxic positivity and psychological harm. Good vibes only. 3 words. Sounds harmless, right? Maybe even inspiring. But what if I told you those 3 words are quietly destroying mental health across millions of people? What if the very advice designed to help you stay positive, look on the bright side, everything happens for a reason, is actually a form of psychological violence? Today, we're exposing the dark underbelly of the self-help industry. Because the truth is, your positive thinking might be slowly killing your emotional health, and nobody's talking about it. Let's dive into the science of toxic positivity. We live in an era obsessed with happiness. Social media feeds overflow with motivational quotes. Self-help books promise you can manifest your dream life. Wellness influencers preach that you just need to raise your vibration. But here's what they won't tell you. This relentless pursuit of positivity is making us sicker. The term toxic positivity was coined to describe something insidious, the cultural pressure to maintain optimism at all costs, even when facing legitimate pain, trauma, or crisis. Harvard psychologist Dr. Susan David calls it by another name: emotional suppression. Think about that. Every time someone tells you, just stay positive, when you're struggling, they're not helping you. They're asking you to suppress your humanity. And here's the twisted part. We've been trained to do this to ourselves. When you're drowning in anxiety but tell yourself others have it worse. Or when you're grieving but force yourself to find the silver lining. That's self-inflicted toxic positivity. The question is, why does this happen? And what is it doing to our brains? Let's talk about what happens in your brain when you suppress negative emotions. Research by psychologist James Pennebaker at the University of Texas revealed something shocking. Emotional suppression doesn't make difficult feelings disappear. It amplifies them. When you actively hold back emotions, your body treats it as stress. Your cortisol levels spike. Your heart rate increases. Your immune system weakens. In Pennebaker's landmark studies, participants who were forced to suppress emotional experiences showed elevated stress biomarkers for days afterward. But it gets worse. A 2025 meta-analysis published in health psychology journals found that chronic emotional suppression is directly linked to increased rates of depression and anxiety, weakened emotional resilience, psychosomatic disorders, where suppressed emotions literally manifest as physical illness, damaged interpersonal relationships. Think about cancer patients who smile through chemotherapy and say, "I'm fine." Research shows they're not protecting themselves, they're isolating themselves, cutting off crucial support networks exactly when they need them most. Here's the cruel irony. The self-help industry tells you to manifest positivity to heal. But the science proves that denying your pain prevents healing. Why? Because negative emotions aren't bugs in the system. They're features. Let's destroy a dangerous myth. There are no bad emotions. Anger, grief, fear, anxiety, sadness. For decades, these have been labeled as negative feelings we should overcome or transcend. But cutting-edge research in psychology reveals the opposite. These emotions are sophisticated information systems evolved over millions of years. Anxiety alerts you to threats and helps you prepare. Studies show moderate anxiety actually improves performance on complex tasks. Anger signals boundary violations and motivates you to create change. Research on social justice movements shows that righteous anger is a catalyst for systemic reform. Sadness slows you down and forces reflection. Neuroscientists have discovered that sadness enhances analytical thinking and attention to detail. It makes you process information more carefully. Grief is how we honor connection and process loss. Without it, we can't form deep attachments. Dr. Susan David's research proves that emotional agility, the ability to experience the full spectrum of emotions without judgment, is one of the strongest predictors of psychological well-being. But toxic positivity cuts you off from this wisdom. When someone going through trauma is told everything happens for a reason, their reality is being erased. When a person with clinical depression is instructed to just think positive, they're being told their suffering isn't valid. This is where toxic positivity becomes psychological gaslighting. There's a term in psychology you need to know: psychological bypassing. Coined by psychologist John Wellwood in 1984, it describes using spiritual or positive thinking to avoid dealing with painful psychological material. It's an escape hatch, a way to leap over difficult emotions rather than work through them. The wellness industry is saturated with this. High vibrations only. You create your own reality. Gratitude cures everything. These aren't just unhelpful, they're dangerous. Research published in 2024 found that people exposed to toxic positivity messages showed increased shame about their genuine feelings, higher rates of emotional isolation, delayed recovery from trauma, greater risk of developing anxiety disorders. Why? Because psychological bypassing creates a false dichotomy. You're either enlightened and positive or stuck and negative. Real healing doesn't work that way. You can't think your way out of trauma. You can't gratitude journal your way out of clinical depression. You can't manifest away systemic injustice or personal tragedy. Healing requires sitting with discomfort, facing the monster in the room, accepting that sometimes life is genuinely, irredeemably hard, and that's okay. Let's look at what actually works, the research the toxic positivity industry ignores. Acceptance and commitment therapy, ACT, developed by psychologist Stephen Hayes, is built on a radical premise. Accept your emotions, don't fight them. A 2026 systematic review analyzing 143 studies found that ACT, which teaches psychological flexibility and emotion acceptance, significantly reduces depression and anxiety symptoms. More importantly, these improvements last. Compare that to positive thinking interventions, which show short-term placebo effects that fade within weeks. Another game-changing study. Research on emotional disclosure by Penny Baker found that when people wrote about traumatic experiences, fully expressing their pain, fear, and anger, they showed improved immune function, reduced doctor visits, lower depression scores, better problem-solving abilities. The key? Honest emotional expression, not forced positivity. Even the negative emotions we're taught to fear have protective functions. A 2025 study on anxiety found that people who accepted anxious thoughts performed better on challenging tasks than those who tried to suppress them. The science is clear. Emotional authenticity heals. Emotional suppression harms. But the self-help industry can't profit from that message. They can't sell you the antidote if they admit the poison came from them. So what do we do with all this? First, stop categorizing emotions as good or bad. All emotions are data. They're trying to tell you something. Listen. Second, practice radical validation for yourself and others. When someone shares pain, don't reflexively say, "It could be worse," or "Stay positive." Say, "That sounds really hard. I'm here." Third, embrace emotional agility. Feel your feelings fully, without shame, and then choose your actions consciously. Fourth, hold the self-help industry accountable. Demand evidence-based approaches. Question anyone selling you a simple formula for complex human suffering. Here's the truth toxic positivity doesn't want you to know. You don't have to be okay all the time. You're not broken for feeling pain. Your darkness isn't something to fix. It's something to understand. Real resilience isn't about maintaining a permanent smile. It's about having the courage to feel everything, to honor your full humanity, and to know that sometimes the bravest thing you can do is admit, "I'm not okay," and that's okay, because good vibes only isn't healing. It's hiding, and you deserve better. Share this with someone who needs permission to feel.